Okay, so we're going to start with the cholera awareness for today that we've scheduled for everyone to be educated. So the person who's going to take us through is Dr. Montali, our very own temp from corporate business. So be attentive and listen. If you've got any questions, we'll take them at the end of the session.
All right, good morning. Good morning, Prudential.
Morning.
Okay. So today we're going to talk about cholera and its definition, what it is, its cause. Okay. So talk about the definition, the cause, how it is transmitted, the signs and the symptoms, how we can prevent it, and the basic treatment for cholera. Okay. So at any point, if you have any questions, please do ask. All right. So now, what is cholera? Cholera is simply a gastrointestinal infection, or as you may term it, it's a diarrheal illness that is caused by a bacterium that is known as Vibrio cholerae. Okay, so it is a common cause of travelers' diarrhea, meaning that you may go to a place that is infected with this bacterium, and you will develop diarrhea in an incubation period of about 2 days. So the World Health Organization estimates that about 1.2 to 4 million cases of cholera happen each year, and from that figure, about 21,000 to 143,000 deaths occur. So we may see that the mortality rate for cholera is very, very high. Now, this disease is endemic to countries in Africa and Asia because of the conditions which are in these countries, as we're going to see as we move further. So just a brief pathogenicity of cholera and how it works once it enters our bodies. So number one, you ingest the bacterium, and this bacterium is very resistant to the gastric acid in our stomach. So once you ingest this bacterium, it will go into our intestines and it will secrete its toxin that is called enterotoxin, and it will cause chloride channels activation. All right. After the chloride channels are activated, you will have a lot of watery secretion in your intestines, and you lose a lot of electrolytes like sodium and bicarbonate. So once you are infected with cholera, you are going to have a lot of diarrhea. Not only diarrhea, you're also going to have vomiting. All right. So now, how is cholera transmitted, and what are the risk factors of cholera? So majorly, the route of transmission for cholera is via the oral route. So ingestion of contaminated water or food. Water that has got the Vibrio cholerae will give rise to this illness. So ingestion of contaminated food and water. Second one is human to human transmission. This doesn't mean that when you touch a person with cholera, you automatically have cholera. No. What this simply means is that it is transmitted through fecal-oral route. So if a patient with cholera contaminates the food and then you eat the food, end up with cholera. Or if they defecate in the water and then you drink that water, then you'll be infected with cholera. Some of the risk factors for cholera: decreased sanitation. This simply means poor surroundings, a very dirty surrounding, poor hygiene, and contaminated water. Another risk factor would be ingestion of certain foods, for example, seafood. Okay, seafood like shrimps may be a habitat for the Vibrio cholerae. So if you eat seafood that is not properly cooked, you have there's a risk that you may get cholera. Another risk factor is decreased gastric acid production. Decreased gastric acid production is also a risk factor for cholera. What are the signs and symptoms of cholera? So once we are exposed to the bacterium Vibrio cholerae, the incubation period is between 1 to 2 days. So it takes 1 to 2 days for you to start showing the signs and the symptoms. But it's very different for different individuals. So the incubation period ranges from 12 hours to 5 days. You can get infected now, and after 12 hours, you start manifesting the signs and the symptoms of cholera. What are the signs and symptoms of cholera? You have watery, non-bloody diarrhea. So the diarrhea has got a fishy odor, and it has a rice water stew in appearance. So that it will be watery diarrhea, and when you look at it, it may appear as if there is rice that dropped in that stew. The diarrhea will last about 4 to 6 days, and you may lose about 1 liter of water in an hour in severe cases. So those in severe cases, you may lose 1 liter of water. But we must take into mind that they are mild cases and there are also severe cases. So the mild cases would be those where you just have gastrointestinal discomfort and your diarrhea is not that much and you may not be vomiting. So if you have those signs where you have diarrhea, but it's not very severe, you may consider replacing those fluids that you are losing and the electrolytes that you are losing. Okay, so there is significant losses in fluid and in electrolytes in cholera, and it can lead to death in about 12 hours if it is untreated. Always remember that cholera kills about 50 to 70% of untreated patients. So it is very important that you seek treatment early. Okay. Another symptom is vomiting. So the vomiting is non-bloody and it has a fishy odor as well. Other signs that you can see in cholera is that you can have very dry mucous membranes. See, yeah, you can detect this if you have decreased saliva production because of dehydration, because you're losing a lot of water. You may have sunken eyes and you have a decreased skin tegor. You may also have fatigue because you're losing a lot of sodium through the diarrhea. Those are electrolytes, and you also have muscle cramping. Some of the complications that you may get because of cholera is aspiration pneumonia. So aspiration pneumonia is where you have an infection in your lungs, because when you are vomiting, some of the vomiters may go in your lungs. All right, and it may have an infection in the lungs. Another complication may be acute renal failure due to excessive fluid loss. When you lose a lot of water, it means that your blood volume goes down. If your blood volume goes down, it means that the amount of blood that is going to your kidneys has been reduced. So because of this, your kidneys may shut down acutely. So those are some of the complications of cholera. It is a very severe, serious disease that may lead to a lot of complications. So let's take care of ourselves. All right, now, how do we prevent cholera? How do we stop cholera? Number 1, food and water sanitation. Wash your hands often with soap and clean your water always. So let this be a habit. Always you wash your hands before you eat. Always wash your hands after you eat. Drink and use safe water. Always treat your water with chlorine, and you may boil the water for about a minute, up to 30 minutes. All right. I prefer we don't drink water from the tap. If we can, let's buy water. Let's not drink water from the tap. Let's not buy water from the streets. I don't trust that water from the streets. All right, so let's buy water from places that are safe. Cook your food very well. Keep it covered. Prevent flies from getting on it, because flies will carry the Vibrio cholerae. Eat your food whilst it is hot, and always remember to peel your fruits and your vegetables. I know it is mango season. Do not eat that mango with its covers. Please peel them. All the fruits, doesn't matter where it is from. It may be from ShopRite. Peel it. Okay. Now, consider getting vaccinated as well. So in 2017, they came up with a vaccine for cholera, and it reduces the mortality for cholera in about 90%. So the vaccine is called Jokoro. You may get vaccinated for cholera, especially in high endemic places like Zambia. All right, so always clean up safely in the kitchen, in the place for bathing, and washing clothes. All right. Now, treatment. Everyone is supposed to know the basic treatment for cholera. It may not be you, it might be someone close to you. All right. So the treatment for cholera is very, very easy. The treatment is rehydration, rehydration, rehydration. Rehydration is simply fluid replacement therapy. In cholera, there is severe diarrhea, meaning that you lose a lot of water. Remember, we said that if you leave this disease untreated, it may kill you in about 12 hours. So if someone is showing signs and symptoms of cholera, fluid replacement is very, very important. So we use oral rehydration solution, highly available, very cheap in pharmacies, and we highly are thankful because we are given this oral rehydration solution here in Prudential. Okay, but if you do not have the oral rehydration solution from a pharmacy or that one that is packaged, you can always make your own at home. So how you do it is that you get half a teaspoon of salt and 6 teaspoons of sugar and add it in a 1 liter of clean treated water. That's how you make your ORS. Treating people with ORS will reduce the mortality, the death rate for cholera with about 99%. So the mortality decreases to less than 1%. So the role of antibiotics in cholera is not very pronounced, but if we were to use antibiotics, we use antibiotics like tetracycline and ciprofloxacin that we are given at the clinic. All right, so this was the presentation on cholera. If you have any questions, feel free to ask.